Good
Good
evening.
evening. Okay, so thank you very much for joining us this evening for this evening's webinar as we celebrate the Ghana Psychology Week 2025. And as we continue to deliberate on the theme mental health across the lifespan from prevention to intervention, we would also like to have some understanding of the kind of research we do in our field as psychologists and also across the social sciences as well. My name is Annie Owusu Nkulenu. I'm going to be your moderator for this webinar, and I welcome all of you to this program. So do a brief introduction of our abled speaker for today, and then I'll give the floor to our speaker to have his presentation. Okay, so our speaker for today is Dr. Eric Delle. Dr. Eric Delle is a work and organizational psychologist with over 15 years experience in conducting research and consultancy services. Dr. Delle holds a PhD in work and organizational psychology from Macquarie University, Sydney, Australia, as well as a Master of Philosophy and a Bachelor of Arts in Industrial and Organizational Psychology and Psychology, respectively, from University of Ghana. And currently, Dr. Delle is a senior lecturer at the Department of Psychology, University of Ghana, and teaching, his teaching includes advanced qualitative analysis, that's at the PhD level, statistics and data analysis, and then psychometrics at the MPhil level, and then statistics for psychologists, and then psychological tests and measurements at the undergraduate level. Dr. Delle serves as an external examiner for the Doctor of Business Administration dissertation at the Noble International Business School University, that's NIPS. And then he teaches leadership, human resource courses as well, which span across strategic leadership, cross-cultural leadership, personal leadership at the University of Gold Coast, that's formerly the Accra Business School. Dr. Delle is the founder and director of Psych at Work Institute, a consultancy organization that provides human resource and psychological services for Ghanaian organizations. And he is a work analyst with expertise in development and technical human resource protocols. It includes performance assessment tools, schemes of service, job grade structure, and that's training for various organizations. And you know, apart from all this, although he's very busy and all that, he has hobbies, you know. And one of his hobbies, I don't know how it became a hobby, maybe he will explain it to us, but one of his hobbies is sleeping. How it became a hobby, probably he will tell us in his research. And then he also likes to do data analysis. He likes listening to music, specifically reggae music. And then he loves to cook. So he's a man of diverse expertise, and probably he's going to put us into the swings of understanding what psychology research is all about and what it entails. So please help me to welcome our speaker, Dr. Eric Delle. Dr. Delle, over to you.
Hello.
Hello, Doc.
Yes, Annie, thank you for that introduction. Well, so thank you, Ghana Psychological Association, for the honor done me. There are so many people in the field of psychology to have nominated or selected me to do this presentation. For me, it's a great honor. So in order that I don't waste much of our time, Madam Moderator, can I share my slide?
Yes, please. You may go ahead.
Okay. Well, so can my slides be seen?
Yes, Doc, we can
Yes,
see you.
Doc.
Okay, so honestly, when I got the topic for my presentation, research in psychology, I was wondering whether I was coming to teach research methods, psychostats, test and measurement. So to start with, I would like the audience to know that this is not a usual research methods class, psychostats class. It will be a more practical section where you see how psychologists leverage research, science in their practice. So the first thing I would like us to note is that there is a strong connection between science and psychology. There's a very strong connection between science and psychology. If you are trained and licensed to practice as a psychologist, you will appreciate the fact that we deal with complexities. And the decisions we make for our clients, on behalf of our clients, have huge consequences. Some people think we are witches, we are wizards. But the truth of the matter is that they say that because we deal with complex issues, we are able to do an assessment and arrive at conclusions that are valid and reliable. And we are able to do that because of our strong connection with science, because of how we conduct our work as psychologists. As we progress, you appreciate this point very well. So we should note that we are scientists, not scientists in the sense that we are physicists, we are biologists, we are chemists, etc., etc. But scientists because we follow a model which is scientific in nature. And so to that extent, our thoughts, feelings, and actions must reflect and advance science. In the audience, I'm sure that we all have seen psychology in scientific form, right from undergraduate to even master's level. Everything we do follows the scientific model. And that is so because through science, we are able to diagnose someone as being depressed, as being anxious, as being stressed. We are able to diagnose someone as having a particular personality disorder. And the extent to which that particular disorder will affect how well the person functions in his or her environment. And so that is how I want us to contextualize research in the field of psychology, either as academics or practitioners. And we all know that a psychologist can work as an academic and a practitioner, can work purely as a practitioner, and can also work purely as an academic. So we cannot decouple psychology from science. Our practice is grounded in science simply because the goals we share with other sciences like physics, chemistry, and those goals reflect in the way we practice our discipline. For example, if you go to a psychologist with an issue, the psychologist cannot look at you in the face and know exactly what the problem is. The psychologist cannot just look you in the face and indicate that you are depressed, that you are suffering from marital dissatisfaction, that your poor academic performance is as a result of A, B, C, D. That is not how psychologists work. I'll give you a practical example. About 10 years ago, I took someone to one of the greatest clinical psychologists Ghana has ever had, late Professor Dankwa. Now, this was a case involving a child with a disorder. Now, with my undergraduate training in psychology, I noticed that this child has a disorder. This is an innocent child who has been chained by the mother simply because this child was very aggressive, disruptive. But the features in the child clearly shows that no, this child has a disorder with a squint eye, protruding tongue, and very aggressive. So I spoke with the mother that, look, I could take them to see a clinical psychologist who could conduct an assessment on this child and put the child on an intervention. So the woman agreed. We went to Prof's clinic around Jowulu. Now, Prof made me sit, in the consulting room whilst he started the whole process. Now, I want us to appreciate, the impact of research in consulting as a psychologist. Prof did not just tell the woman that, look, your child has maybe Down syndrome, Klinefelter syndrome. No, Prof started by gathering data. So the first question Prof asked this woman was, how many children do you have? In the order of your children, this child, is he the last born or the firstborn? Then the woman answered. Then Prof asked, at what age did you conceive for this child? She mentioned the age. Now, during that period of pregnancy, did you take any herbal preparation? Did you take any unprescribed drug? These are questions we usually will ask when we design a questionnaire to measure a particular behavior, a particular attitude, etc., etc. And so you look at the case and you ask the right questions. So your questions must be measured. And the questions that you ask your client helps you to arrive at a certain conclusion that leads to an appropriate intervention. So Prof proceeded. Okay, now to the issue of labor. During labor, what happened? The woman indicated that the child was coming with the legs. So it means there was a problem. So how long did it take the medical doctors to rescue that situation? Approximately 3 hours. And so Prof indicated to the woman that that delay affected the flow of oxygen into some essential brain areas. So those places got frozen. And that accounted for your child's disorder. So essentially, Prof had to gather data from the client, and with that data, was able to describe accurately, precisely, what might be the disorder and what might have caused that disorder. And then the name of that disorder, and then some intervention. So Prof concluded by saying that, look, he will prescribe some medication to deal with, the aggression, the unusually high level of aggression because of the flow of some neurotransmitters, hormones, beyond certain thresholds, which causes the child to be that aggressive. So when you are writing your report, you document all these in your report, because those descriptions, explanations, assessment allows you to accurately diagnose a person and then propose an intervention, if you like, a medication, prescription, treatment for that person. And I want to believe that that is what our clinical psychologists do. As they encounter clients, as they take them through therapies, they collect data, they conduct interviews. We can relate this scenario to what medical doctors do. Anytime someone visits them in the hospital, right from the OPD, data is being collected. You may call it a survey. They will look at your folder, archives, archival data, secondary data, and then they will pick primary data. They will check your temperature, your pulse, and ask you what brought you to the hospital. It is data being collected. From the OPD, you are made to see a consulting doctor who also takes you to another round of data collection. And then possibly prescribe a lab for you to do to validate, what he or she may be thinking might be wrong with you. It is that model that we follow. That is research in action. So this may be a typical consulting room where a psychologist is engaging, interviewing, collecting data from a client. When you find yourself in this situation, your observational skills must be resurrected. You must be very sharp in terms of observation. You must be very sharp in terms of how you analyze the responses from your client. You must be measured in terms of the questions that you ask, because you see yourself in a research situation. With your training, you appreciate this process and how it will help you to do proper assessment and diagnosis of your client, to help you write an acceptable report that we can call an expert report, a report coming from an experienced, well-trained psychologist. These are the things we do so that people, think that the psychologist is like a god, it's like a witch, it's like a wizard. We read people's minds. Etc., etc. So we must maintain this status quo. It is that which makes us psychologists. That is why the Ghana Psychological Council will want to be sure that you have undergone the training, the process, before they can license you to practice. We do not want a charlatan to parade himself or herself out there as a psychologist. It will be very damaging to the profession. And so we embrace what we call the scientist practitioner model. Our services must be grounded in science. The evidence we provide must reflect science. Our conclusions must be valid and must be reliable. Can you hear me?
Yes.
Yes, please.
Sure,
Very
sure,
clearly.
Doc. We can hear you, Doc.
Okay, good. Thank you.
Yeah.
So let's appreciate research from that angle. That in the field of practice, you may not necessarily issue a questionnaire to a client, a patient, an individual to complete for you to now enter this course in SPSS, check for mean standard deviation values before you are able to proceed. It doesn't mean that you cannot do that. We provide different services. Someone may request the services of a psychologist to know who he or she is. That one, you'll be doing personality profiling. You'll be doing personality profiling. And so with that, you will give a personality questionnaire to the person to complete. Then you go analyze that and write a report for that person. This evening, Annie introduced me as a speaker for this occasion. I can say that Annie is a conscientious person, but that will be literal. Literally, I can say she is a conscientious person. But in the context of psychology and practice, that statement is not scientific. To make it scientific, I will have to administer the conscientiousness personality scale on Annie. And then based on her score, I will now be able to write a report that shows that indeed Annie is a conscientious person or Annie is not a conscientious person. And colleagues, friends, we should understand that that report has a lot of implications. It can advance Annie's career. It may be the reason why Annie's career may not progress, especially if the role Annie wants to occupy requires a consensus person. The personality report indicates no. Unfortunately, that individual is not consensus. That is why we must be very careful what we say, what we write as our report. It must be something that we can defend. It must be something that the Ghana Psychological Council, Ghana Psychological Association can defend you at all times because you are trained to do the right things. Any report you write as a psychologist, it has legal implications. It has legal implications because it can either be the reason why someone will suffer some undue consequences, or someone will be given something that he or she doesn't deserve. For example, as a work psychologist, I conduct an aptitude test, conduct interviews, and then for a particular applicant, I lower the bar and ask very simple questions, which aids the person to eventually get the job. Only for the employer to find out later that this person is not actually performing on the job. But on the basis of my report, the organization, the employer gave this person the opportunity. And so that is why we must ensure that regardless of our biases, prejudices, the reports that we write on people must be devoid of personal sentiments, biases, and prejudices. So one more time, we are scientists. And we are scientists that deal with complexities. And so if we must maintain our enviable position, we must not depart from the framework. Now to other issues, we depend on data, as I've indicated earlier on. A psychologist carefully collects data on a person, on a group of people, and that data becomes the basis upon which you're able to make an informed decision and provide interventions. So for example, the IO psychologist will collect data about job performance, abilities, job satisfaction, and attitudes towards safety. The clinical psychologists collect data about depression, anxiety, personality disorders, etc., etc. And that data helps you to profile those individuals you pick the data from. And based on that, you're able to develop a tailored intervention. And that tailored intervention is implemented to provide a solution for the individual. The same way the medical doctor will listen to you, pick that data, let you do some lab, prescribe some medication for you. And then when you take that medication as prescribed, all things being equal, we expect you to experience some relief. And so to that extent, let's not allow ourselves to be influenced by biases or prejudice. We are humans, and we have our own biases, our prejudices. But when you wear your psychology cloth, when you sit in your consultancy room to practice, to work, you must not allow those personal biases to determine or change how you practice psychology as a science. I have turned down people in interviews, people I know. But at the end of the day, you want to be fair. I have not recommended people for jobs because you want to be fair. So you kill your personal sentiments and prejudices so that you do the right thing. It's about your integrity. It's about the fact that someone has given you a job to do and you have done it well. You can defend it anywhere you go. And the strong research background that we have, statistics background that we have, put us in that enviable position. So let's look at other scenarios. The IO psychologist is a medical doctor in work organizations. And I say that proudly, that every single employee in the workplace, we observe them. The systems put in the workplace, we analyze them. So in terms of observation, you are able to identify a certain toxic behavior. A supervisor who shouts at subordinates. A supervisor who bullies subordinates. These are unacceptable behaviors. Behaviors that undermine the human being. And these behaviors have huge implications on the mental health of that employee. And that has a potential to affect the productivity levels of those individuals who are victims of such toxic behaviors. You have observed that. It means that those managers, those supervisors, are candidates for proper psychological assessment. We want to find out whether they have a certain personality disorder, which makes them drive joy, happiness when they shout at their subordinates. And so through that, we're able to develop and implement tailor-made interventions to solve work and performance-related problems in the workplace. And so some of these issues may even require that as a work psychologist, you refer cases to a clinical psychologist. For example, a supervisor who engages in toxic behaviors, which is affecting the performance of his or her subordinates. The initial intervention that a work psychologist may put, if it doesn't yield any positive results, you may want to refer that person to a clinical psychologist to do a thorough assessment. Maybe the person is having multiple disorders. The ultimate goal is to help this individual to function effectively in life. A clinical psychologist also do a lot of things. They collect data to be able to diagnose people in terms of whether they are depressed, they are anxious, they are stressed. And this work cut across contexts. A depressed employee will have productivity issues because depression has the potential to affect how you think properly and relate with people in the context of work. You are anxious, it has serious implications on how you work. You are stressed, it will affect your productivity levels. Outside of work, we all know the implications of these. Stress, depression, anxiety. Some students have recorded poor performance because of unusually high levels of anxiety. depression, stress. And so we are able to help people, individuals, when they approach us, and then we walk them through the process of getting to know what exactly might be the cause. Why do we say the psychologists follow the scientist practitioner model? These are terms that we are very much familiar with, what we call the goals of psychology: description, explanation or understanding, prediction, and control. And for me, as an academic, as a practitioner, I see this as a very fitting framework that allows us to conduct an assessment, to profile people, and write a report that reflects the science that we practice. So let's look at these points one at a time. How do you know someone is depressed? We mentioned data collection. And so you must systematically describe what we observe, hear, or listen. It's very important. And you cannot do this if you don't engage the person, if you don't listen to the person, if you don't have some data on the person. And that description must not be abstract. It must be precise, it must be concrete, and it must be relevant. So let's bear that in mind. Description is very important. Like a clinical psychologist will tell you that, oh, this person lacks appetite for food, lacks appetite for sex. This person is thinking of committing suicide. How did you get that information? Okay, it is through the data collection, and it helps you to describe carefully, precisely, properly what the situation is. And that description allows you to do proper measurement, proper assessment. It helps you to narrow down on what might be the problem. Whether the person might be depressed, might be suffering from some chronic anxiety, some stress, because the description will highlight some characteristics. So, according to this scholar, until the phenomena of any branch of knowledge have been submitted to measurement, it cannot assume the status and dignity of science. So measurement is key. In psychology, we are trained to be able to quantify and measure what we do. So our work is grounded in measurement. And you cannot measure if you don't have data. You cannot measure if you don't do proper analysis of the data that you have or that you have collected. And that data may be primary, it may be secondary. The analogy I gave using the doctor-patient, issue, you realize I mentioned that there could be some previous information in the patient's folder. That is secondary data, which we discuss in research method class. But the checking the BP level, the pulse, etc., the OPD, and even in the consulting room by the doctor, constitute primary data. And we piece all these data together to make sense of what might be the problem with a person. And that data collection may include lab, where the person may be asked to go and do some lab. In psychology practice, we may put someone in an observation room, observe to see whether there will be some changes in the person's behavior or actions. So in terms of data collection, we may collect data in the lab, we may collect data in the real world. And that affords us the privileged opportunity to get our measures right. Now you have described whatever the person may be suffering from. You must provide some explanation. An explanation helps us to really understand the issues at hand. And those explanations must be logical and they must be sound. Those explanations help us to understand and know the causes of that particular behavior, why the person is performing poorly, why the person is engaging in distorted thinking. So it's a flow. If you're able to do proper description, then it helps you to be able to identify the antecedents, the causes. Someone has come to the hospital, has been diagnosed of malaria. From your interaction with the person, you get to know that, oh, the person lives in an unclear environment where stagnant water is everywhere, facilitating, the breeding of mosquitoes. And once you find yourself in that kind of environment, it becomes clear that you get malaria. And malaria is caused by a parasite who sucks your blood and deposits the parasite in your system. So the explanation helps us to understand why you are suffering from a particular situation. So let's look at an example. We do research as psychologists. So if our research findings demonstrate that emotional intelligence makes a nurse at the OPD work effectively, then based on this empirical evidence, a psychologist should be able to explain how emotional intelligence training or emotional intelligence therapy might make a nurse at the OPD work effectively. And oftentimes, we see these things, we hear people explaining these things. It is the explanation that helps people make sense of what we are saying. So if you tell me that working under a good leader helps you perform well. It may sound illogical unless it is properly explained. That, for example, a good leader creates the right environment, the right support system for you to thrive. Similarly, emotional intelligence training will help a nurse at the OPD to acquire the skills of emotional control, to remain calm under an emergency situation. That is why we are saying that emotional intelligence will make a nurse work effectively at the OPD. It is that understanding, it is that explanation that we need to offer. And we are able to do that effectively because of our research and our training. The last but one point, prediction. Our predictions are not 100% accurate. And as a matter of fact, we all know an apology for that. Because, or after all, there is no scientific discipline whose prediction is 100% accurate. Not physics, not chemistry, not biology, not pharmacy, not engineering. And so it is about probability. And we all are very much conversant with the 95% decision rule. And so our research works contain error margins. And the research works also help us in practice. And so to that extent, we must try as much as possible to minimize the error margin. And that is why data collection is very key. We must be very much careful when we are collecting data because it will help us to identify relevant antecedents. It will help us to really understand what we are assessing properly. And it will help us to be able to make prediction. So there may be a medical evidence that a particular drug is 95% effective in treating malaria. But that does not guarantee a cure for malaria. The psychologists face that. The interventions that we develop and implement are not 100% proof that there will be a solution. But we can assure the client that the margin of error is very small. We can assure the client that the client has a role to play. It's like you doing right diagnosis, prescribing the right drug to a patient, only for the patient to not follow the prescription. So to that extent, the patient, the client has a role to play. The same way, if an educational psychologist should put a student who is recording poor performance on a therapy that will lead to performance improvement, which probably includes reading, having a workable personal timetable, eating well, and then the student is not following that intervention. And so if performance does not improve, you cannot blame it on the intervention because the client has a role to play. Then finally, on control, ultimately, we want to provide a certain sort of relief Why will you diagnose someone as having depression and yet not provide a certain intervention that will bring some relief? That is where the control comes in. By control, we are not saying that we are taking away your autonomy, your independence. By control, we are talking about an intervention that will bring a certain relief. It may cause some discomfort, but that is necessary to bring that relief that you want. A student or an individual who engages in distorted thinking, filtering, always looking at issues from a one-sided view, that can be very problematic. An individual who is suffering from depression and from assessment, you get to realize that it's as a result of distorted thinking. You may want to put the person on the cognitive restructuring therapy that will help restructure the way that person thinks and analyzes issues. A medical doctor prescribes medication and dietary changes to reduce blood pressure levels of a patient. That is control. And so previously you used to eat anyhow, plenty meat, plenty oil. You used to drink hard liquor, but now you have high blood pressure. Based on the assessment conducted, some intervention has to be made. And that intervention may include that you swallow pills on a daily basis, you check your diet, because your cholesterol levels are unacceptable. That is the control we are talking about. You must make some commitments, some sacrifices in order that the intervention is effective. So that is the research and the science that we practice as psychologists. So on that note, my concluding remarks. The decisions we make for and on behalf of our clients have huge consequences. So we must not behave like the driver mate who has not been licensed to drive to take over the steering wheel to drive people to a location. We all know the consequences. An accident once happened, the consequences cannot be reversed. Similarly, if you are not well trained and licensed to practice psychology the way it should be practiced, a single misdiagnosis, a single wrong report has the potential to ruin someone's life. That is not the psychology that we want. So psychologists must embrace the scientist practitioner framework. We are science, and science is us. Thank you so much for your attention, and I'm very much grateful for the opportunity.
Thank you,
Madam Moderator.
Thank you so much.
I guess I'm within time.
Yes, you are. Yes, you are. Thank you so much. Thank you so much. I can see a lot of people applauding, and I'm sure we've learned a lot today, because we as practitioners seem to go about our duties, but probably may not have paid particular attention to some of the key aspects of research and its relevance to our practice. So thank you very much for this insightful presentation. We'll open the floor for some questions, as many as possible. And if you are able to ask a question, you can raise your hand, I'll call you, or you can put it in the chat and I'll read it out for Dr. Delle to respond. So we'll call for some questions. Probably, Doc, I will start.
Yes, that's fine.
With mine, yes. So I'll ask psychologists and as practitioners, the issue of biases come to play most of the time. And sometimes you have clients who find it difficult to even understand the boundaries of your practice and find it difficult to even know when to align with the kind of practice you are having or the kind of sessions you are having with them. How best would I apply myself as a practitioner when a clients come in and try to take away all the biases and also help the clients to understand that the data I'm collecting should be relevant enough for me to help him or her?
Hey, Annie, this your question is like a thesis question. Well, so as I indicated in the presentation, we all have our own biases and our own prejudices. We are fully aware of that. But we must also appreciate the point that you represent a profession, and that profession is guided by a code of ethics. It's guided by a code of ethics. And so my first response will be that you must operate within the code of ethics. That way, you are safe legally and professionally. Now, you must also appreciate the fact that a client will go to every extent to get you to do things that maybe ignorantly, they don't know that it is against your profession. And that is why you must provide some form of education, okay, to the client, if need be. If need be. And when you are collecting data, you must not allow those your biases to influence that data collection, because it is that data that you use to do the assessment, the diagnosis, and then develop the intervention. And so you don't want to find yourself in a situation where the data so collected is not accurate. And once the data is not accurate, it means that your measurement, your assessment might not be accurate. And so you end up putting the person on an intervention that is not effective or that will not work out. That will not work out. And so we can look at case by case, right? But the ultimate goal should be you doing the work well, doing the work within the context of your code of ethics. Any other? And if you have any follow-up question, you can ask.
Thank you. I think
so let me give you this practical example. And this is a work psychology example. We did some interviews some time ago, my time with Psychon HR. And then we had this candidate who by far was the best applicant we interviewed for that job. But I didn't recommend the guy for the job. Unfortunately for me, we were just two people on the panel who conducted the interview, so there was no split. And my friend was wondering why the best candidate I am not recommending for the job. So I suggested that we invite the guy to come back later for a personal discussion. Because in my view, the guy was too good for the job that he has applied for. And we are representing an organization as consultants. Our integrity, our competence is very key. We don't have to recommend someone simply because the person did well in the interview. We should think about whether the person will feel motivated to do that job and stay with the organization, for some time. And for me, I felt that this guy, one, didn't know the job he was walking into. And then most importantly, he will not last in that job. I give him 3 months, he will leave that job. So he agreed with me, and then we invited the guy over. So the first question I asked, in fact, actually graduate, very fine brain. So I asked him, do you know the job you have applied for? Then he said, oh, loan officer. In fact, that time we did that for one of the banks, the loan officer. And I said, yes, but do you know the nature of that job? That job will require that you go from market to market looking for people to come for loan. Then he said, is that true? I said, yes. And then he opened up. That look, after service, he's not gotten job. He's been applying for jobs he's not getting. It's more than 2 years now. So now he has decided that any job that is advertised, he will apply for it. And so we took our time to explain to him why this job is not good for him, and that if he's not careful, he will suffer mental health crisis if he starts this job. And so as consultants, what we'll do for him is that we will keep his CV. Organizations keep knocking at our doors. When that opportunity comes, we'll invite him for an interview. He was very happy that, we walked him through that process. We walked him through that process. And so today we are discussing mental health. As a work psychologist, I tell people that if you are not placed on the right job, or you don't do the right job, it has serious mental health implications. And so we should look beyond the scores that people obtain when they go through the process. We should look beyond that. As psychologists, we need to do that. It helps those individuals. But giving them an opportunity so that you're able to explain to them is very much beneficial. And that is within the confines of our protocols as psychologists to do these things. So that is what I just wanted to add. Annie, Madam Moderator, thank you.
Thank you very much, Doc. Thank you very much. Any other questions? If you have a question, you can raise your hand or mute and then you ask. But before that, I'll go to the chat and see if there are any questions. So I see some comments. Control is everything. That's by Dr. Juliet. Comfort says great insights gained. Sally says awesome presentation. And then I have thank you, Doc, insightful presentation. I have thank you so much for the educative presentation. Bravo, very informative. And then wonderful presentation. I'll try to see if there's any question. Okay, so there's a question in the chat box which says that great presentation, Doc. In case of online counseling, how do you get observation from the client?
Okay, yeah, so that's a good question. Now, counseling process, you have to design the process carefully. As psychologists, we usually will not recommend that you do everything entirely virtual, because there are huge implications that psychologists have even had to suffer some of the consequences. And I'll give you a practical example before I proceed to address your question. This had to do with, in fact, it happened during the peak of COVID. Then organizations relied solely on virtual interviews to make recruitment and selection decisions. And so there was this organization that hired someone, and I'm sure there was a mistake with how they conducted the whole virtual interview. So someone was picked for a job and was then asked to come to the head office for the appointment letter. Now this person arrives at the head office, and then the HR is like, is this the person we gave the job to? Apparently the person has a problem with one of the legs. And the job this person has been hired for requires standing for long hours. And so they had to, deny the person the opportunity on the basis that physically the person is not fit for the job, the role. Now that attracted compensation because the person has to be compensated. It is not the person's fault that you made that mistake. In fact, if I were to be part of that process, the final stage of the interview would have required the person to come to the head office for us to look at the person before we issue the appointment letter, right? So we are in the era of telepsychology. We use technology to do all kinds of things. But at the same time, we should be minded by the fact that the work that we do as psychologists has serious consequences. And so we shouldn't make certain mistakes. So in the context of counseling, you can have different stages. The initial step may include you doing some virtual, activities to help you collect some data. But you should get to a point where you want to have an in-person session, especially if the issue you are dealing with requires that. And so our training required that we should be able to adopt the best of approaches to conduct our assessment and then implement our interventions. And so solely restricting everything to a virtual model might not be helpful in some circumstances or situations. And so that is my response to the questioner. Thank you so much.
Thank you very much, Doc. I hope the question has been answered. I've had people asking in the chat whether the recording is going to be circulated. And yes, I learned the recording is going to be sent to us. And then there's another question. Kindly educate us on the basic training one requires to be able to diagnose another person or client.
Well, okay, that's another good question. The first response to that is that psychology belongs to a very diverse field. Okay, and then in terms of assessment and diagnosis, it may vary slightly from discipline to discipline. So for example, as a work psychologist, there are a variety of issues that we deal with. And each issue will require, the use of a different model, to do the assessment. So for example, if an employee is suffering from performance-related issues, how I'll go about conducting the assessment may be different from an employee who is suffering from bullying, say bullying from a supervisor or a superior. So it will always depend on the case. Now, but so if you take clinical psychologists too, for example, there may be some slight variations in terms of how they conduct the assessment, depending on what they are looking at, right? And so generally, we look at data collection as an integral part of the assessment and measurement process, which we all do as psychologists. But at what point do you want to collect data? And so look at your area. If you're into counseling, and even counseling, which area of counseling? Some are into marriage counseling, some are into work-related counseling, so that you are able to adopt a model that is acceptable within your field of practice. Unfortunately, I'm not able to share with you, okay, this is the model we all follow, because there are variations. And the cases to determine how you should approach the assessment process. And in fact, it also depends on the experience level of the psychologist. And here I'll give you a personal example. A student was recommended to me, and this is someone who was giving the parents a hell of time at home. The father is a chartered accountant with a consultancy firm who wants the son to pursue a bachelor's degree in accounting, proceed to charter as an accountant, and then inherit his business. This boy too is not interested. And so he was asked to come and see me. Now, the first day the guy came, there was no show. I didn't start the process with him. I chose to take a walk with him on campus. We had some personal discussions, and I shared my personal experiences with him. And then I asked him to go home. And then anytime he was willing and ready to come, he should just give me a call, and I'll let him come over. And this is based on my personal experiences and then my understanding of psychology. Okay, so the model is there. So the first day I didn't collect any data. I just shared my personal experiences with the guy. We walked around campus. I showed him nice places on campus, etc., etc. It was the second time he visited that we started the process. And so you may not find this in any outline when it comes to how to start an assessment process. But that helped me, to forge a certain good relationship, to break down any fears, etc., in the person, in the client. Today, the guy is very happy. In fact, the father called and was wondering how I was able to deal with that situation, because now there's peace at home. Okay, so that is my response to your question. So look at your area carefully. And then, yes, a hand is up.
Okay, kindly unmute and then ask your question.
Okay, good evening, everyone, and good evening, Doc.
Good evening.
For that insightful presentation, we are grateful to you and the many lecturers in the department for sacrificing to help us understand the issues. This is a follow-up to the question.
Yeah.
Now, the idea is that we have individual experiences in solving these problems. But the question is, how then do we integrate that into our curricula to be able to practically teach our students to be able to solve some of these problems? That would be my question.
Okay. So thank you so much. Now, our individual experiences are very important. I can imagine how the experiences late Professor Dankwa galvanized over the years informed the way he practiced as a clinical psychologist, informed the way he used to teach as a clinical psychologist. Now, the example I shared with you is an example that I'll continue to use. And I say so because it is something that I'm monitoring and evaluating. You want to get to a point where you feel that, look, it is workable, it is effective. And then that may reflect in my writings to contribute a piece to how a work psychologist should approach, career-related decision-making from a counseling point of view. And so until you get to that level, it cannot find itself in a classroom. It cannot find itself in the literature. You need to be able to write it in such a way that it is coming at the back of experience that has been validated, experience that has been documented. So in this case, it's just one person that I used that approach on and it worked, right? So it will eventually come to the classroom with time. The same way any of us here are acquiring experience in the field of practice, in the field of teaching, and then our experiences gradually are finding space in what we teach, in the talks that we give when we are invited. And one day, those experiences will find way in the books that we write. And so this example I gave today, and some of the examples I gave, I use them in my lectures. We discuss them, we debate them. And so it will find way one day in books. And I encourage all of us to do same.
Thank you very much, Doc.
Yes, you're welcome. Yeah.
I hope Sesimpe has been answered. I think I saw Josie's hand up earlier, or Josie's question. Josie, if your question hasn't been answered yet, kindly unmute and ask your question. Then I'll go back to the chats as well.
All right. Thank you. My question has partially been answered, but let me throw this out there. There's already that misconception about the fact that our practice is very much subjective. Um, Even in the way we collect data, which I disagree to because, of course, there's the art part, there's the science part of it, and then there's the art part of it, especially considering how nuanced human behavior is and can be. But then again, it's really got me thinking because I've had discussions with people and these things have come up hello.
Yeah, continue. Yeah.
Okay, these things have come up. Of course, I have defended as much as possible. But I mean, especially given the example you gave, in a situation where you're in a hospital setting, you don't have a large team, and you have a client. For when you have walk-ins or so, um, based on whichever hospital you work with or whatever protocol you have set for yourself in your facility, you might either have to see the cases as they come. You might not have an idea of whatever you are going to see. Uh-huh. So in a case where you are the only one or your team is not large, we are seeing all sorts of cases, even though your field of study or your area or your background might not necessarily be in counseling or developmental or this, that, 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 that. But then you are forced to see that case because, of course, it is psychological. And obviously, with our setting, our cultural setting, patients usually want we have this orientation of my doctor. So immediately they need some form of solutions. And so probably what you did with your client by taking them to campus, working and all of that, so that it buys you some time to now put a specialized assessment for him. You might not have, or someone else might not have that luxury of
Yeah,
time to
that's
do
true.
so.
Yeah. Mm.
How do we handle something like that?
Yeah, so thank you so much for that. It's a really great question. And so that's why we operate in different contexts and we deal with different cases. Okay, so I want to believe that the example you gave fall within the context of clinical practice where you find yourself in a hospital environment. Okay, and then you have to attend to patients, right? And so that gives you a different context. Even with that, if you practice as a private consultant, you may want to create room for some of these things to be done, okay? Because you have autonomy with regards to the protocols. And you believe that this approach might yield a good outcome. Okay, but where that flexibility is not available, you cannot do that. You just have to go by the protocols available. Okay, and that is why I keep talking about the diverse nature of our field, and the fact that we grow with time and we increase, our experience profile with time. And with that experience, you are able to, navigate around certain protocols just to achieve the right results. So my uncle, for example, who is a medical doctor, a dermatologist, Rabito Clinic, will tell me or tell us that, look, he spends a lot of time with his patient in the consulting room because it helps him, one, to cause the patient to relax. It helps him to engage the patient to the extent that he's able to gather sufficient data to do proper diagnosis of the patient. And so because of that, anytime he's consulting, the patients, one, understand. Two, they know that they will get the best of assessment from him as a doctor because he takes his time, engage you, so that all the fear that you may have, will decay. So you feel relaxed, and then do proper introspection. And I want to believe that he adopted that approach because of the experience he has galvanized over the years. Now, I say this with confidence because if the patient is not put in a certain situation where he or she can do proper introspection, you may end up getting the wrong data. In fact, personally, I've gone to the hospital and felt like, this was not the reason why I came to the hospital, because you walk into the consulting room and it's like you are rushed through the process. You feel tense. You struggle to, organize your thoughts. And so at the end of the day, whatever you manage to tell the doctor may not be sufficient, but you are rushed through the process. And so to answer your question directly, to the extent that the protocols are not flexible, you have to go by the protocols. Okay. But if with time, with experience, you feel that there are better ways to attend to patients, to produce better results, you have to experiment and try them. And all those things have the potential to change the way we practice with time. Yeah. Thank you.
Thank you very much, Doc. I've seen that there are a lot of questions being asked, but because of our time, I'll ask that we go straight to the point in asking our questions. And so we'll just give those whose hands are up, raised, just some few seconds to ask their questions, and then we'll ask Doc to round up with your answer. So I'll ask Emmanuel Obing to unmute and ask your question briefly, and then we can continue.
Yes, good evening.
Thank you very much for your presentation. Doc, I have a little issue bothering me. I work as a mariner and also a counselor for the port. Of late, I've monitored something when students come for intense or service, and you ask them about their course they do and then the reasons. It's like most of them tell you that my mother said, my daddy said I should do, so that's why I pursue that course. But as for me, it wasn't my intention. I want to find out about the school counseling sessions at universities. Wouldn't it be appropriate that all students are scrutinized or take through some career guidance and counseling before their final selection of programs? Then also, I've realized that most corporate institutions are not giving attention to mental health issues, especially when they talk of counseling. It's like most of the companies around Tema and Accra, big companies, when you go there and find out, they don't have any counseling units. And for that matter, mental health issues are not well attended to. So, I want your opinion on how best we can help this situation. Thank you.
Okay, so yeah, thank you so much.
Okay.
Then that means give us consultancy work. we,
That's why I say I need your number.
okay.
Okay.
That's fine.
Doc,
So yes.
Doc, kindly let's take the questions now so that you can round up with your remarks, your answers and remarks, so that we will not take too much time in asking the questions. So briefly, we'll take
problem.
the next set of questions. So from Honorable, I can see Honorable Jalil. Kindly
Hello.
unmute and ask your question. Yes, please.
Hello, Honorable.
Yeah. Hello. Good evening, Doc.
Good evening,
Good
Honorable.
evening to fellow participants. This is Honorable Jalil from Tamale.
Okay, Honorable.
Yeah. Yes, sir. Please, it's a question and enlightenment, just an education that I need here, or a support that I need some education. It's about a client who came to me asking for me to, make her make a choice.
Honorable, your line is breaking. Can you position yourself well?
A right choice to at Canada. Really loves her. Hello.
Hello, Honorable. Your line was breaking at some point.
Your line keeps dropping.
Okay. Are you okay now? Can you hear me, Doc?
Yes.
Yes.
Yeah, I think it's a network problem. I'm sorry for that.
Yes, please, if you can briefly ask the question.
Yeah, the question is just that I need a clarification. A client come to me for help, asking me to, help her make a choice whether his man love him or not. So I want to know what strategy or what experience, what should I do to her for her to go and make that right choice.
Okay. Yeah. Okay. Annie, is that the last questioner?
No, please. I have Idrisu, and then I think Dr. Dixon was also on call. So I'll have Idrisu and then Dr. Dixon, and then we'll round up.
Okay.
Yeah, this is Idrisu.
Yes.
Yes, Doc, thank you very much for that wonderful presentation. I wanted, by experience, what I noticed is that some of the, especially in the close of us, the client come very long history of parental influence in the people's life that has resulted to the person current situation. I just wanted to find out how can we counselors be able to successfully rope in parents and providing help to our client.
Okay.
Okay. So thank you very much for the question. If is Dr. Dixon available? Hello, Doc.
Annie.
Okay, it's Dr. Coleman. I think Dr. Coleman also had his hand up.
Okay. Should I answer the questions, so are they available to ask?
Okay, so whilst we wait for Dr. Coleman, you can start answering the questions, please.
Yeah, so the last two questioners, I think that their cases should be referred to a counseling psychologist, preferably, especially Honorable's own, someone with expertise in marriage counseling. That person will be able to help Honorable to navigate his question or get an answer to his question. Now, to the other person too, similarly, he will need guidance from a counseling psychologist. I am a work and organizational psychologist, and so I'm not able to give you a clear-cut solution or way out regarding the questions that you have asked, except to say that for the last person, if the person has a long history, you need to really understand that history, because it is part of the process of helping you to be able to do proper assessment, And so you need to really look at that data carefully, understand it very well, so that you know where the person is coming from, before you can proceed. So, but you still would need guidance from a practicing counseling psychologist to be able to navigate some of these issues. And then to the first questioner about the career decision making. Now we are in an era where we are talking about self-leadership. The fact that the responsibility when it comes to career-related decision making lies and almost entirely in the hands of you, the individual. Now, institutions like schools can play a role through their guidance and counseling centers or units. But that in itself requires that the individual is proactive enough. So, for example, if you come to the University of Ghana, we have a whole directorate for guidance and counseling. But it requires students to assess the facility so that the experts, the professionals in that unit, will help you to make proper career decisions. Now, as an IO psychologist with expertise in vocational psychology, I always tell students and individuals that it is important that you identify a career. It's very important. And beyond identification, you need to be able to identify the competencies required, the personality profile required to do well in that area. You need to understand the labor market, the changing nature of the career environment. All those things help you to make sound and logical decisions in terms of the career to pursue. That in itself helps you to be able to develop a CV that is a reflection of who you are and what you can do. So we expect individuals today to be more proactive because we have fewer jobs than can absorb the numerous graduates we are churning out there. And so the support systems are there in terms of guidance and counseling units. Now, it is left onto the students, individuals to assess those, units and assess the services of professionals. As for some of us, we are there. We are private consultants. If you assess our services, it comes at a fee and you get a best of service, especially when it comes to career-related issues. And again, finally, regarding mental health issues in your workplace and most organizations in Ghana, mental health issue is a very complex issue. And the factors the causes of mental health issues are multifaceted. I gave some examples in the course of my presentation this evening that being exposed to a toxic supervisor or leader has the potential to cause depression in an employee. And so when we interact or engage with some employees, some examples like, I feel very happy when my supervisor is on leave, it's indicative of the fact that there may be some behaviors from the supervisor that is disturbing. Wrong placement of an employee in the workplace has the potential to cause stress. How do we define stress? We say stress arises when the demands of the job exceeds the capacity, psychological, physical capacity of an employee. With time, the person will experience stress. And so sometimes the decisions we make in the workplace, create mental health problems for employees. So when we walk into the workplace and we conduct assessment, we are able to see the cracks, the issues, and then develop interventions. It may include redesigning the job, redesigning the work environment, so that people feel, a work environment that is positive, that is humane, and that is driving, positive interpersonal relationship and productivity in the workplace. So just come to think of it, the workplace has now become our first home. We spend most of our productive hours in the workplace. And so we must begin to think of how to humanize the workplace, where people feel home in the workplace and not a chaotic environment, that becomes, an environment for well-being issues and crisis. So we should go sometimes beyond the employees and look at the supervisors. Look at the managers. They may be the cause of these issues. And then to conclude, I want to thank Annie, or there are some questions. Can I conclude?
Yeah, I think, Doug, we have 2 more questions, okay, and then we'll round up. Okay, so okay. I see Dr. Abdul Nasiru.
Okay.
And then I have Dam as well. So Dr. Abdul Nasiru will ask his question, and then Dam, and then you can conclude.
Hey, my boss.
Right. Thank you very much. Mine is not a question, but to encourage such interaction regularly from time to time. It brings out very important issues that people need to be aware of and all that. And also to encourage the questions that are kept coming in. It opens the door for all of us to be learning professionally, all that. I want to just add to what Dr. Delle excellently responded to about professionalism and knowing the difference and all that. Yes, at the psychology department, we know ourselves. Professor Dankwa at the time, may his soul rest in peace, was a clinical psychologist. I am an industrial and organizational psychologist. I was consulting for an organization, doing recruitment, doing the personality profiling, which can be used for leadership development. I did that excellently, got a very brilliant leader. Unfortunately, down the line, about 6 months or so later, the lady started exhibiting some kind of behaviors and attitudes that showed the person has some kind of issues, mental issues. I don't want to say mental disease, mental issues. And they got back to me that, oh, Mr. Consultant, this is what we have seen in this person's behavior. Since you are the psychologist, handle it for us. So I invited her. She came, and based on my initial assessment, I realized, no, this is not the work of an industrial psychologist. So I referred her to Professor Damkwa at the time, who handled her professionally as a clinical psychologist in his clinic, did so nicely, and everything was successful. Unfortunately, there was a relapse, and the time she came back, Professor Damkwa is dead. I'm just hammering on the points that Dr. Delle made. Identify where your area is, and if possible, refer professionally to someone else who has the capacity to be more professional, so that you cover yourself and also you cover the name of the profession. Professor Osafo also, I was there. Then he came to me, hey, Alaji, I have some job for you. some 3 important international recruitments. And he said, no, you have been doing it. You know how to do it. I like you do it. And I handled it. Of course, when you do that, you have to also go sit down with the person who brought you the business. Because Osafu is a psychologist, but he was aware that at that time, it was me. I was doing the kind of job. And so the emphasis is on what Dr. Delle just indicated, professionalism. Workplace counseling should be separated from the counseling psychologist's work in a manner that professionalism will be exhibited. And when you do that, you are protecting our profession as psychologists. So this is just what I just want to add to all that I've said. Thank you very much and for the brilliant presentation. And Madam Moderator, I salute you. Thank you.
Thank you very much. Thank you very much, Dr.
Thank you so much, my boss.
No, and then
Dr. Eni says my boss.
Then the last question from Dam. I see the name as Dam. So kindly ask your question and then we'll round up.
Okay, thank you, Madam. And thank you to Doctor for the presentation. I've learned a lot. And I had about 3 questions, but in his conclusion, he's answered all of them. But I need this one clarification. If, for instance, you are in an organization that you see that, let me use the boss, okay, that maybe the boss is toxic and it's affecting other colleagues, maybe including yourself, and you realize that the organization is not ready to hire external consultants, and they are also not ready to report. If it's a government institution, they are not ready to report, and they are even gagging you, or they are gagging the staff. They don't want anything from the organization to go out, yet you see that colleagues are being affected negatively. Yes, of course, we are learning here. So if we see something wrong, we should be able to know, as you've been teaching us. So if we see such things, how should we report so that people will not get into trouble, so that the person who is having maybe personality issues or having issues that is causing, for example, bullying and other things, will also be helped? Then everybody will be helped and it will be a balanced situation.
Well, that's another great question.
Thank you.
Well, so organizations have their own protocols. So let's put it this way. You are a victim of supervisory toxic behavior, and then that is affecting your performance or your well-being. The first point of call will be to, let's say you're a immediate supervisor, the first point of call will be to engage HR. Okay. But the example you gave seems to suggest that, there's no way out. It seems to be the climate, it seems to be the norm, okay, in that organization. And you mentioned a public sector organization, right?
Yes.
So it now comes down to personal decision. You now have to decide, because it appears that HR cannot help, other superiors cannot help. They usually, when your productivity is suffering because of a certain misbehavior from a supervisor, okay, it should reflect in HR documents, where HR probably will now want to see how best, that toxic behavior from a supervisor can be worked on through training and other interventions. Now, I'll just use an example to address or answer this question. This was a consultancy work that we were supposed to do for, a top hospitality industry in Ghana. And then the general manager of that organization then was an expatriate, a British. And that time I was with Cycon HR. So we were asked to come and have an initial discussion with the general manager then. And then the general manager described a situation in the workplace that it starts from the managers and trickle down to the subordinates and from the subordinates to the customers. So it's having a cascading effect. And so it became a very toxic work environment, which was affecting business. And so as a general manager, he felt that it was important that something was done. And so that at that point, we recommended that, look, the best way to approach this, especially because it's coming from managers to subordinates and then to customers, was to do personality profiling. We needed to profile all the managers because some of them may be manifesting their personality and then they are unconscious of the effect, the negative effect of their personality on their subordinates. So in this particular case, the general manager, wanted to get that situation dealt with. And so consultants, experts can be commissioned to come in, conduct assessment, collect data, and then introduce the interventions that will bring the solution that the organization needs. Okay. But the scenario you projected, it appears there is no one in the organization superior who is interested in getting, an intervention put in place. And so it comes down to personal decision. You, the individual, what is the way out? And oftentimes, people decide to leave that organization, because they feel that it will affect their well-being negatively. Okay.
Exactly.
So that is my response to that. But that is a very bad situation. And it is happening in so many organizations. People are being affected. But in the case of public sector organization, it's government. And so sometimes, whether there's high level of productivity or no high level of productivity, no one is interested. Government is paying your salary. So just keep quiet and suffer. But this may not happen in a private sector organization where particularly productivity is being affected. And finally, I'll just end with this example. And this was shared with me by an HR manager that their top marketing consultant resigned because their CEO shouted at him. And he was shocked because this is a marketing consultant who is earning $10,000, like twice more than what he earns as HR manager. And the guy resigned. So the CEO asked him to go convince this guy to come back and that he was ready to even increase his salary. So he went as HR to engage this marketing consultant. And then the first thing the marketing consultant told the HR manager was that, look, I'm not a small boy. So for the CEO to shout at me as if I'm his child or something, my dignity, my respect is more important to me than the money he pays me. So no amount of increment will change my mind. I'm out of this place. And so the issue of personal decision, when particular this is coming from the overall boss has undermined you, disrespected you because he or she feels that, he calls the shots, he pays you salary. And so you must be a slave to him or her. If you continue to work in that kind of environment, you'll be diagnosed by a clinical psychologist as suffering from depression. Because exposure to that kind of toxic, chronic environment it's not healthy for any human being. Yeah, it's not healthy for any human being. So there are some personal decisions that we get to a certain level that we have to take, especially when you realize that that is a norm in the organization. No one seems to be bothered. No superior seems to see it as a major problem. And no amount of workshops will change that situation. We can come to that organization and conduct training program on well-being, mental health, but the people who are causing those problems are still there. They need profiling and proper training, to take that evil out of them, to exorcise those things out of them. Otherwise, they will continue to create and recreate that kind of environment that will create the well-being, mental health problems in the workplace. And so let's think about these things and not approach mental health, issues from the perspective of just talking. It is real. And there are people who are causing those issues in the workplace. And as psychologists, we have been trained to be able to do an assessment and identify individuals who are creating these problems in the workplace. So that will be my concluding thoughts. And
yes,
we all should be the ambassadors for a great psychology profession in Ghana and beyond by demonstrating the highest level of ethical and professional standards. If there's a project for you to do and you think that you need a team to do a better job, reach out. Maybe you need industrial psychologists to be on board, clinical psychologists to be on board. You form that team. That projects the field better in a more dignified and respectful manner, than a situation where, you behave like a jack of all trades and not project the field properly. So thank you once again for the opportunity. And the sky is the limit for Ghana Psychological Association and Ghana Psychological Council. We should just continue to do the right things to project our profession. Thank you and good night to all of you.
Thank you so much, Doc. Thank you so much. We are so grateful for the insightful presentation. Because of time, I would advise that we continue this conversation. Let's continue the conversation on our various platforms. And also, remember there's going to be a panel discussion tomorrow during the AGM, which starts exactly at 9 a.m. prompt at the Center of Biodiversity at UG, University of Ghana. So take note. And then there would also be ID card stand as well. The T-shirts will be collected. And then various reports on the divisions program, the various divisions programs will also be given to us. So we call for maximum participation tomorrow as we round up with the AGM as well. And one announcement is that we'll be wearing the cloth, the Ghana Psychological Association cloth tomorrow. So kindly take note of that. Thank you very much, Doc, for the insightful presentation. Always take note that whatever data you are collecting from your clients has its own consequences, and you must be cautious of the kind of data you collect and how you interpret this data. Thank you very much for your participation this evening, and hope to see you all, God willing, tomorrow. Have a good night.
We need doctors for doctors for marine.
Okay, so I'm sure for doctor's number and the recording, it would be sent to us as we wait for the recording to be put together. So we'll get a feedback from that. And then let's continue the discussion on our various divisional pages. Thank you.
Thank you.
Thank you very much, my controversial friend.
Hey, you've been hiding. You are indeed a controversial friend. Okay. Thank you for the opportunity, Annie.
Doctor. Hello, doctor.
Thank you, everyone.
Thank you, everyone. Good night.
Thank you.
Good night.
Good night. Good night.
Bye-bye.
Sweet dreams.